I get extremely stressed when a patient comes into my office and says the following: "Doctor, I had a nerve injury during a hip surgery," or "I had a nerve injury during a shoulder surgery, but I'm not worried because that doctor is already treating my problem." So then, why are you here in my office? Guys, this video is meant to guide you if you've had a nerve injury and are being treated by a doctor who isn't a specialist. If I have an artery or vein injury during one of my surgical procedures, I'm not going to treat that problem myself. I'll call in a vascular surgeon who is the specialist best prepared to handle that complication. But nerve injuries are treated by all doctors. The only problem is that no one is really prepared to meet the expectations that this kind of treatment requires. So here's an essential tip for you. Treat a nerve injury with a nerve specialist. If your doctor, who is treating this injury, doesn't understand what the outcome will be, which tests to order, or what expectations you should have for recovering from this weakness, neuropathic pain, or loss of sensation, then maybe you need someone to help guide you so you can get better. Here are some tips that your doctor may not be prepared to follow in your treatment. First of all, your doctor was unsure whether you actually had an injury or not. It's very common for patients to suffer for months before convincing their doctor that they have a nerve injury. And then the doctor says something like, "Well, it does seem like there was an injury. It's strange. Shall we order some tests?" A nerve specialist, just by examining you, will already notice that something is wrong, that some function is missing there. Secondly, the doctor says he's going to wait. "Doctor, how long am I supposed to wait?" "I don't know. Let's wait. Let's check again in a year." This is an extremely important warning sign. Waiting a year without knowing what to do next means the doctor doesn't know what he's doing. We need to have a plan. How long are we going to wait? Which test are we going to order? And then what are we going to do if the result doesn't come back? So if there is no improvement in strength within 3 months, we should order an electroneuromyography. If this electroneuromyography doesn't show signs of reinnervation, we'll proceed with surgery. What will be done in this surgery? If your doctor doesn't have these answers and doesn't have a plan, seek a second opinion. And finally, the doctor says it will get better on its own. How can he be absolutely sure it will get better on its own if he didn't even know what the injury was before? Stay alert, seek a second opinion. We've already talked about it here on the channel, and you already know that nerve injuries have better outcomes when treated early. Don't wait for an answer that will never come. Seek help immediately. If you liked this video and noticed that there is little information about peripheral nerve injuries on the internet, help me produce more content by liking this video and following our channel.